Hi, and welcome to the first edition in 2012 of Sex Talk, brought to you by Student Health and Counseling at UCSF. Today we have two questions, and Lisa DiGiorgio-Haig, our nurse practitioner here at Student Health, is here to answer your questions. The first question is, Hi Lisa, I am a male in my 30s. I just started dating someone who I am very sexually attracted to. We engage in making out and foreplay, which has been amazing. When we try to have penetrative sex, I will lose my erection often. This is frustrating, awkward, and embarrassing as I want to enjoy sex with my partner. The more I think about it, the more anxious I get. I will then try to avoid sex to avoid the awkwardness. Is it possible for me to have a good sex life? Please help.
This is Lisa DiGiorgio, nurse practitioner, and I'm going to try to answer our first question about erectile dysfunction. First, I want to say I really applaud the person who wrote this question. It is a difficult situation for any guy to deal with, and it can be difficult and frustrating for partners to deal with as well. If you're in a relationship, I want to say how important it is to try to communicate with your partner. It's difficult when you're in a new relationship, but if you can talk about it, that's really helpful. And for partners out there who are dealing with this problem, it's important to be supportive and understanding of the situation and of one another. It can create feelings of inadequacy in both men and their partners. People tend to internalize their feelings and blame themselves, and this really doesn't help. If you can avoid doing those things, that's great. If you can talk, that's great. If you feel like you can't talk to your partner, you can always come into Student Health and talk to one of us, because we deal with this more often than you might think. There are two broad categories of erectile dysfunction: psychogenic, which means psychological, and physiological. And sometimes erectile dysfunction can be a combination of the two. As far as physiological factors go, things that might cause ED are medications that can interfere with sexual response. And this gets into a separate issue, which is reduced libido, which we can cover in another sex talk. Chronic illness like heart disease or high blood pressure, diabetes, physical disability, alcoholism, drug use or injury that impedes blood flow to the erectile tissue, high cholesterol, which can limit blood flow through the arteries that supply the genital area, can also be associated with ED. Another important risk factor is cigarette smoking. If you think that your ED could be psychological, there are maybe physiological, there are maybe tests that your healthcare provider should run, and you should definitely have a thorough history either way. Psychological concerns, including stress, anxiety, self-esteem, or fatigue, can also cause ED. And like I said before, sometimes it's a combination of both. Some questions a healthcare provider might ask: do you have firmer erections during sleep or when you wake up? Are you able to achieve erection and/or orgasm with masturbation? In other words, when you're by yourself, do you have these problems? And do you have erections and orgasm when you're engaging in other behaviors besides penetration or intercourse? The answers to these questions, as well as physiological tests like an ultrasound or neurological assessment, can help determine the root cause of ED. And then depending on the cause, different treatment options are available. And I won't get into the treatments now. They range from medication to hormone replacement to therapeutic aids, vascular surgery, or sex therapy and couples counseling. If you are concerned about ED, again, I would encourage you to make an appointment. If you want to bring your partner in, that's totally acceptable to us here at Student Health Services. Sometimes couples counseling and sex therapy is really helpful, and if you're interested in that and you want to bypass Student Health Services and seek out a sex therapist, you can check out the American Association of Sexuality Educators, Counselors, and Therapists, otherwise known as AASECT, on the internet, and click on Locate a Professional. While you're determining the cause of your ED, you can still be intimate with your partner, and I strongly encourage activities other than intercourse or penetration that you both enjoy. I always recommend people taking a break from intercourse or penetration and try focusing on non-genital sensations such as kissing and cuddling, or pleasure each other by caressing, touching, and stroking one another, having oral sex, or incorporating sex toys into your sex play. way. Ask yourself, what non-intercourse intimacies do you enjoy? What about my partner? Have you discussed all the things you like that don't require an erection? And have fun trying those things out. And yes, it is very possible to have a healthy sex life. Most people with this issue overcome it with help and figure out ways to go on. And my motto is that every person's entitled to a joyful sex life.
Thanks, Lisa. Our next question is brought to us by another student. The question is, what is the best way for a woman to ask a man out on a date for the first time?
When I saw this question, I was really happy because this is an issue that's sort of near and dear to my heart. I wanted to broaden the issue to include asking anyone out for a date. I think it's sometimes tough for men and women to take that leap. Anyone who knows me knows that I am the woman who asked her husband out on our first date, asked him to move in with me, and asked him to marry me. And that was 23 years ago. So it worked really well for me. And it wasn't just him. I actually asked every boyfriend I ever had out for the first time. And I have to say that I came from a very culturally restrictive background. I had a very serious Italian Catholic father who had no idea this was going on. And it actually never really came up with my family. It's just something that I decided early on to do so I could sort of take control of my social life. So I am a big proponent of going after what you want. And there's different ways that you can go about it. One way you can do it is to just be direct. You know, I want to see this movie. Would you like to go with me this weekend? Or some of us are going to this event on campus. Sometimes a group approach, and then during the group activity, trying to get closer to that person and hang out with them. Asking someone what their interests are is always really helpful. Getting them to talk about themselves is really helpful because sometimes you realize you really don't have anything in common. But what's more likely to happen is the person will mention something that really interests you as well, and then you can sort of glom onto that idea and go with it. There's great events happening all over the city that are really fun to do as a group or with one other person that would be in a group setting, so you could ask someone. You know, you could get a bunch of people to go. Asking people out for food is kind of nice, although I usually recommend coffee or a cocktail because I think eating dinner with a stranger can be really daunting. What do you order? How do they eat? Your table manners. It can be too anxiety provoking. So for a first date, I would recommend either coffee or a drink or a cocktail or a non-alcoholic beverage if that's your thing as well. I've heard some people say that they've asked people to study together. I think that's kind of not the direction I would go in, but I did do a little bit of research on the internet on this, and this was one of the suggestions I read, so it might work for some people. Be sure to give some information about yourself, but don't talk about yourself too much. And another useful thing can be to give someone a choice. Would you be interested in going to have a coffee, or would you like to get a cocktail? One of the most useful things that I read can really help boost your confidence. This is a good approach. This is kind of the approach that I took, which is that rather than being prepared for a response of yes or no, just assume that the person would, of course, want to go out with you. Why wouldn't he want to go out with you since you're such a cool person? Instead of saying something like, oh, if you have time, maybe we could do this, and being unsure of yourself, approaching it in this way. This is fun. We should continue our conversation over lunch. What kind of food do you like? Your confidence, even if it's a bit of a bluff, could certainly be contagious. I say have fun asking, be prepared for rejection. If it happens, move on. Get back on the horse and try it again. Because I guarantee you the person you're asking may really feel relieved. If I had never asked my husband out, I would have never seen him again because I found out later he was too shy to ask me. So good luck. And keep us posted with your questions. We love getting them.